Aloha, I'm Barbara Tom. I'm with the Waipahu Safe Haven Immigrant and Resource Center. And today we're here with Jonathan Hiltz. He's a public health educator and information specialist from the Office of Public Health Preparedness with the Department of Health. We will do a Q&A related to the recent outbreak of the COVID-19 in Hawaii. Uh, we hope to provide translated information for the community through this process. But I'm going to introduce Jonathan now, and Jonathan, you can take over.
Okay, well, let's just get started. I know a lot of people are very frightened about this COVID-19 situation. We're trying to keep it as much in control as possible so that as few people as possible get sick and something worse can happen to them. So let's just talk a little bit about what this actually is. So COVID-19 stands for coronavirus disease from 2019 because it got started last year. Coronaviruses are they're a large family of viruses that have like crown-like surfaces. That's why they're called corona, because it means crown. And so actually coronaviruses are, they're named for crowns. That's what corona means. And it's actually a fairly large family of viruses. They can actually, coronaviruses are found in animals like camels, cattle, cats, bats. We think this might have come from a bat, but sometimes coronaviruses also get into humans. And coronaviruses, there's other kinds of coronaviruses too. Like some of them are actually pretty mild, like they cause the common cold. And that's pretty mild. People don't die from the common cold. But then sometimes the animal ones jump to humans and we get something more serious like COVID-19 or from a few years ago, MERS or SARS. So as I mentioned, this was named 2019 novel coronavirus, and now we call it COVID-19. And it started in China. And in China, they started in the city of Wuhan, in Hubei. And people started to notice people were getting sick, and then they were getting these really bad respiratory situations. And this is when we realized that this was spreading really quickly, and we decided that we needed to focus our attention on preventing it from going further because a lot of people were dying. Now, it's very important to know the symptoms and how to treat COVID-19. Unfortunately, because it's a new virus, there's a lot that we do not know, but we can make some assumptions based on other coronaviruses that are similar, like SARS or MERS. So as the situation goes on, we're going to learn more and we'll have more information because it's changing constantly. The majority of cases of COVID-19 have actually been mild, but some of them have had more severe respiratory illness. And when we say respiratory illness, we mean problems with people coughing or having trouble breathing. And actually, those are the main symptoms of COVID-19, that somebody has a fever, which is like over 100 degrees, or somebody has a cough and shortness of breath or trouble breathing. People always are asking us, what are the treatments? But unfortunately, there are no antiviral treatments right now for COVID-19. If somebody gets sick, we try to treat their symptoms so that they feel better as soon as possible. And right now, there isn't any vaccine available, but we're working very hard to try to make one. Hopefully, sometime by the end of this year or early next year, we will actually have a vaccine. That's what we're hoping, but we don't really know yet for sure. So the next question people ask is how we can protect ourselves. And that's actually the good news. The good news is that there is a lot that you can do to protect yourself and your family. So COVID-19 is, as we said, it's a respiratory illness. It affects your breathing. And a lot of the recommendations that we give to prevent COVID-19 are similar to how you would protect yourself, like from the flu or the common cold. So one of the first things that we actually ask people to do is get the flu shot, for influenza. And the flu shot won't actually protect you from COVID-19, but one of the problems that the doctors have is that some people they have these symptoms of like difficult breathing and coughing, and we don't know, do they have the flu or do they have COVID-19? And it makes it difficult for doctors to figure it out. So the fewer people that have the flu, the better it is for everybody in Hawaii, especially for the doctors and nurses. So we want everybody to get the flu shot. If you haven't gotten it, even though it's March or April, it's still not too late to get it. So that's one of the first things that we want people to do, especially because in Hawaii, we're at higher risk of getting the flu. And also, people should do this every year, even when there is no COVID-19. The other thing that we want to do is we want people to practice good hand hygiene, all right? This is really important. We want people to wash their hands as much as possible. So one of the things that we want people to do is we want people to wash their hands a lot, especially after you've touched something, some other surface, maybe when your hands are not clean, maybe somebody's handed something to you and you don't know if they're sick, so there could be coronavirus on it. So we want people to wash their hands a lot, and especially you should wash your hands before you touch your face. So you might have heard this before. You should wash your hands for at least 20 seconds, 20 seconds. And that sounds like a lot, but it's like the amount of time it takes to sing happy birthday twice. So singing happy birthday twice. And you want to wash your whole hand. You want to wash your fingers individually. Okay, you want to wash your thumbs. Make sure you do both hands. You want to take your fingernails and rub them into your palms so that you can clean them. And if you do all this pretty diligently, it will actually take about 20 seconds. And this is something that's really, really, really important. This is actually, this is one of the two best ways, I'll tell you the second one later, but this is one of the two best ways to prevent the spread of COVID-19. The other thing that we want people to do, besides washing your hands, we want people to also practice social distancing. Social distancing is where you keep yourself away from other people because you don't know if they're sick. Right now, you might have heard that we should be staying at least 6 feet away. And if you're not sure how far 6 feet away is, it's about twice the length of your arm. So you should stay away from other people right now because we don't know if they're sick, we don't know if you're sick, and we don't want people spreading the germs between each other. And that is what we're trying to do. So social distancing is very important. We want people to also avoid touching their eyes and their nose and their mouth, especially when their hands are not washed. It's also a good idea to avoid contact with people who are sick. Of course, when your mom or dad or your auntie or your brother or sister are sick, you want to help them, but actually, if somebody did have COVID-19, you want only one person to be taking care of them and keeping everybody else away as possible. If you are sick, you should cover your sneeze or your cough with a tissue, not with your bare hands, but with a tissue or into your sleeve. Okay, if you do use a tissue, you want to throw it away as soon as you possibly can. And also, because you might have the germs on your hands, you want to wash objects, like your phone or a cup or something, or the table. You want to wash these things as soon as you can.
Can you tell me what you should wash the tables in?
Well, the good news is you don't need to have any really special products. You can use any regular, normal, disinfecting product that you have that you might buy at the store. You can use a mixture of diluted bleach with water. You can use soap and water. Just make sure that you're cleaning it pretty well. And you clean things that a lot of people will touch, you clean them often. The other thing we want to emphasize too is that you stay home when you're sick. Right now, we are under a stay-at-home order for a few weeks, and so that's actually it's easier for people to stay home when they're sick. But in general, if you're not feeling really good and you go to school or you go to work, you might risk getting other people sick. And during COVID-19, we really want to avoid that. A lot of people ask, is it going to protect me if I wear a mask? And for healthy people, we actually say there's no reason that they should wear a face mask because masks actually don't provide a lot of significant protection if you're just trying to avoid getting sick. And in fact, people feel uncomfortable wearing them, and subconsciously they might start touching their face with the mask, which actually goes against the whole reason for wearing a mask in the first place. The only group of healthy people that we recommend to wear masks are people who are providing healthcare services to patients. Like if your auntie is sick at home and you're taking care of them, then you should wear a mask, even though you're healthy. We need to keep the mask for the people who are working in the healthcare sector, the nurses, the doctors, the people who are giving tests. we want to make sure that they have enough masks. So if healthy people are wearing masks to just walk around outside when they're not expecting to run into sick people, it actually is using up resources that right now we don't have.
So would you recommend the sick, if they're at home, would you recommend the sick person wear the mask?
Yes, if the sick person can wear the mask, that's actually really good, because the sick person is the one who's, maybe when they cough and sneeze, the little tiny droplets, that is what can make other people sick the most, and also the things that they touch with their hands. So a sick person wearing a mask can help other people, yes.
Now, people are making their own masks out of cloth. Now, do you recommend that, or it's some form of protection if they have a sick person at home?
If they have a sick person at home and they cannot get a regular mask to protect themselves, then that is actually better than nothing. Hopefully we will have enough masks for everybody, but this is a changing situation, and as more people get sick, it might be harder to have masks for everybody. But some homemade protection, if you are caring for somebody who's sick, that's good to use maybe if you do not have a regular mask to protect yourself. So again, regular people who are not sick, who are just around people they don't think are sick, they don't need a mask. But if you are a healthy person who is caring for somebody who is sick, having a mask is good. If you're a sick person, having a mask is good. And of course, if you're a healthcare worker dealing with people who might be sick, then it's a good idea to have a mask.
Because I've seen people in the community walking around with masks. And I think the type of masks they're wearing are basically surgical masks.
The surgical mask, and that's better than nothing, and they might be running into people who they fear are sick, and that's not a bad thing to do. But especially the more serious N95 masks, we do not have enough of those right now, and so people who are healthy and just around healthy people are using those. That actually can be a little bit of a problem.
Can you talk a little bit about isolation in the home and what people should do?
Okay, isolation in the home, this is actually kind of a difficult situation. If you have somebody in your home who might be sick from COVID-19 or has been confirmed positive for COVID-19, it's important to keep them as separate from other people as possible. And it's very difficult in Hawaii because a lot of people have small homes. And maybe you have only one bathroom. Where we live, we only have one bathroom and one bedroom. If one of us gets sick, it's going to be very hard to keep the other people isolated. It's a good idea if this is possible. If there's one bathroom and one bedroom that the sick person can use by themselves, that's the best situation. That's ideal. And then it's a good idea for just one person to be the one bringing them food, and washing their dishes, so that as few other people are exposed to the coronavirus as possible.
So they would be using their own dishes and not mixing it with the general.
That's right. You want to try to keep them using the same dishes, and you want to wash those dishes as soon as you get them, and wash your hands actually afterwards, after you've been around them, and avoid getting too close to them too. Of course, when somebody in our family is sick, we want them to, we want to comfort them, but staying away from them is actually keeping a safe distance at least 6 feet and not being around them too long is actually the best thing that they can do.
Okay, so the other question we have is, when should we be going to the doctor?
We actually want people, we've actually set up phone lines so that we can, and I'll provide you this source, but if you go to our website at health.hawaii.gov/COVID-19 with no dash. That's health.hawaii.gov/COVID-19, COVID-19, no dash. You can go see some resources on there. And one of the resources we put up there is a link to the CDC. That's the Centers for Disease Control in Atlanta. That's the national organization that helps deal with outbreaks like this. And the CDC has a good link that will ask you a bunch of questions and let you know if you should see a doctor about COVID-19 or if you can wait at home and self-isolate. But basically, if you have these symptoms, the short answer, if you have these symptoms like a fever, especially over 100 degrees, and you have a cough, and especially if you have trouble breathing, you should contact your doctor. Call them. Don't go there first. Call them and see what they say, and they'll try to get you testing if you should be getting tested. But especially if you are having a fever, cough, and trouble breathing, then you definitely should contact a doctor. If the trouble breathing is very serious, like, oh my gosh, I can barely breathe, this is really bad, you should call 911. Don't wait to call your doctor. You should call 911 and tell them the situation. We don't want people waiting on the phone when they can't breathe and something really serious happening to them.
So, I hear about testing, but where do they go for the testing? I haven't seen the sites listed for testing of the COVID. Is it only the physician that can send them for testing, or is it a place where they can go and just get tested if they're sick?
Every now and then, like last weekend, okay, we're talking on March 25th right now. Last weekend in Kaka'ako, there was an open testing situation where people with certain symptoms were able to go and be tested. But in general, if you contact your healthcare provider, your doctor or your nurse practitioner, and they will be able to get the swabs, they'll be able to get the things through your nose and then send that off to testing if you have the right symptoms, if you're in the situation where you should be tested. We don't have like a test center, like a drugstore where you can go over and get tested. We don't have that situation right now. You need to go to a healthcare provider.
Okay, so what if they have no healthcare provider? What can you do?
Well, that's a situation that differs from person to person, and a lot of it depends upon their family circumstances and maybe their income level. What I recommend for people to do is to call 211. That's Aloha United Way, and they have resources set up for people to go find out what kind of organization nearby them can provide them health care if they don't regularly have a doctor. And I would recommend for anybody who is eligible who does not have health insurance to contact Quest at 1-877-628-5076. That's 1-877-628-5076, and look into getting health insurance. Because for families that for many families that are here who are lower income, many of them are eligible to get different types of health insurance, and then they can be put in touch with a doctor.
Okay, so the Micronesian community rely on only the open enrollment period, and unless they recently came from Micronesia or their status changed, they are not eligible to get on any kind of insurance unless the state has loosened that requirement.
I am not an expert on this area, and I don't know what situations are coming up. If they are, in general, eligible in certain circumstances, if something like right now, we're having a lot of economic difficulties because of the shutdowns and everything. And if somebody has lost their job, that counts. That should count as a qualifying event, which would make them eligible to apply even when it's not the open enrollment period. I believe that's true, but I would the people at Quest would be able to tell us. But again, there's a lot of different resources out there that I'm not completely sure about, that I don't know everything about. So maybe the people at 211 Aloha United Way should be able to direct them to the right resources.
Now, 211 is in English, and for many of our local population, they rely on an interpreter. So would they be able to be hooked up to an interpreter through 211, or?
211 is supposed to be able to direct them to resources in their language, even though the operators at 211 themselves do not actually, they're not usually able to speak Chukis or Marshallese and other like Coco languages and other Pacific Island languages. I do want to mention that right now the situation in Hawaii is still not like it is in New York, but it is something that we're talking about and we're concerned about, and this is the reason why we've been having uh, a stay-at-home order lately, so that we can make sure that the virus does not spread. Like we can try to prevent its spread as much as possible, and that's the reason why we want people to stay home. Not get into large groups. This is really important, and it's difficult because a lot of us here in Hawaii, big family gatherings. This is something that's very important. But right now, just for a little while, we want to come together by staying apart, and so that we can try to manage the situation as much as possible. So we are working very hard to make sure that people are protected. When we do find out about cases that happen, we at the Department of Health, we have investigators who try to find out who they were in close contact with, so that they can go and try to identify people who maybe should stay home and isolate themselves. We monitor themselves from home. We've also been looking out in the community, just randomly testing flu samples to see if there are places where we're finding COVID-19 that we didn't know were there. And right now, starting tomorrow, there's a quarantine, a 14-day quarantine. Whether you're a resident of Hawaii or a visitor, if you fly to Hawaii from anywhere, you're going to be on quarantine for about 14 days. And you'll have to stay at home or in a hotel. If you're a visitor, you have to stay in a hotel. So we're trying very hard to make sure that people are sticking to that. We want people, when they're sick, to monitor their health. If they do start to have symptoms, contact their healthcare provider. If they are sick or if they think they might have been exposed, we want them to stay home, avoid group settings, have another family member or friend who is not in the same situation, go do their errands for them. Please avoid, if you think you've been exposed, or especially if you're feeling sick, avoid using public transportation like the bus or taxis or ride shares, and watch your health. This is what we want people to do. So remember, if you're feeling sick, or if you're having a cough, stay home, avoid contact with other people, only go out to seek medical care. Contact your health provider, first calling them to let them know what's going on, so that they can see if you need to have a test. And if you do need emergency medical care, if you're having really terrible difficulty breathing, like you think it's very serious, call 911. And if you are having difficulty accessing medical care or have other questions, you can call 211 or call DOH at 808-586-4586.
And this 586 number is manned between the hours of what?
I believe right now it's 7 a.m. to 10 p.m. and it's, no, sorry, I apologize. 211 is 7 a.m. to 10 p.m. and they have a lot of information that we provide them. And if something is more serious, they will let you know to contact us. The other line that I gave you is for the daytime. But we have a lot of resources like the website that I gave you, where you can do a symptom checker and see if you need, at the CDC site, and see if you do need to go and, if you do have the symptoms, where you should get tested or get somebody looking at you.
Now, the president, according to what I heard, had said that anybody with COVID-19 and gets sick and needs help as far as for medical bills, they will be covered. Is this true?
Well, we need to see that kind of talk enacted into actual legislation. But in Hawaii, what you need to do is use the healthcare services that we have here. If you have lost your job, look at, contact Quest, go to healthcare.gov and, do an application. There's a lot of different things that can be done. And try to get healthcare here, and depending on your income level, it might be completely covered. But if you have health insurance, you might have to pay some co-pays. I think they're trying, but we haven't seen this happen yet. But we are trying to make sure that co-pays for COVID-19 are taken care of.
Mhm.
But the problem right now that we have is everything is so fluid. Things are changing so quickly. So it's difficult to say this is the case when we don't know if things are going to change next week, you know.
So I got this information online, and this was if you're sick or fever or cough, do the symptomatic relief like Tylenol for a fever, and just stay at home and drink a lot of fluids. But also, if you don't have a doctor, it says to call the urgent care clinics or the community health centers, or Queens has a helpline at 808-691-2619. And if they have difficulty breathing again, it's the 911 emergency
Right,
call.
right. The Queen's hotline is actually a very good resource. They are very on top of things. The community health centers that are available, these are places that you can go. And COVID-19 is not the first health problem that we've had facing Hawaii. The places that you've gone before to deal with your healthcare systems, so your healthcare needs, if you have such a place, even if you don't have your own personal doctor, those are places that you should still be able to utilize. But yeah, you can call 211, you can call the Queen's hotline and find out more information about where you individually might be able to go.
Okay, and I just wanted to add this because I've been doing some research online. You can create your own, like you said, simple disinfectant with Clorox and water, but you use only 1 teaspoon to 2 cups of water.
Right,
or
you don't want to
1/4
have,
cup
yeah.
to 1 quart of water. You don't want to have the whole Clorox
Right.
going on.
The Clorox is supposed to be diluted. And yeah, the coronavirus, it's not like Superman where like you have to like throw a whole bottle of bleach on it. It's something that on the surface, if you have a regular house cleaning solution, it's going to kill it. The main thing is you just need to make sure that you are doing this regularly and frequently on surfaces that get touched a lot.
And also, the thing that I learned was that after you spray the surface, you keep it on for at least 10 minutes and then wash it off and wipe it dry.
That would work.
So that would clean the virus from countertops or chairs or doorknobs or sink areas where anyone sick might have come in contact with.
Right. That's actually very good advice. And CDC has some great resources to talk about how to clean your home and everything. And actually, they're a very good resource. Here in Hawaii, we get really bad rainstorms. We get hurricanes, and there's a lot of cleanup for that too. And so, this is a very good place to go to get advice about how to keep your house clean, not just to protect against COVID-19, but to protect against mold and things like that, things that we have a big problem with here in Hawaii.
And also at this time, I would like the interpreters to share with the community the grab-and-go meal sites and times for them to know about, because many of our communities really struggling with access to food. Like he said, if you're unemployed, go to unemployment insurance. You can go online there at HUI claims, CLAIMS .Hawaii, spelled out HAWAII.gov, G-O-V. Please ask people if they are out of employment to go on and submit a form to unemployment. They can also call 762-5752 if they can't go online. So I leave that message for the community because I know our community is struggling. Many of them are out of work, and I think food is going to be the next crisis for them. Okay.
Yeah, this is a very, very difficult time, and I think it's wonderful that there are programs like this that are trying to help out the kids, because like especially right now, if they're not in school, it's good that there's an agency or volunteers that are helping out with this. This is a really important time to come together as a community, find out who in your community is especially struggling, see if you can help them. In a lot of communities, and I'm sure in Hawaii this is happening in a lot of places, maybe find some, some elders who are maybe can't go, they're a little bit worried about going and getting groceries for themselves, and see if you can help them. Practice social distancing when you drop off the food, of course. That's very, very important. Trying to, especially with the older, our older community members, to make sure that you're not too close to them, because we want to prevent it spreading. But find out who needs help. From the kids down to the elderly people, the elders. There's a lot of people who need help, and we need to reach out to them. So again, we want to come together by staying apart, but finding out, how we can connect.
Okay, I want to thank Jonathan Rhodes for coming to give us this important information. Thank you, Jonathan, very much.
My pleasure.